Welcome back to the deep dive. Today we're going deep on varicose veins. We're going to be talking about different ways to manage them and really, give you the tools you need to kind of take charge of your vein health.
Right. And it's more common than you think. Millions are affected, and so many folks are looking for relief from, the pain and discomfort.
Yeah, that makes sense. I think a lot of people think it's just a cosmetic thing.
Say
But there's a
definitely.
lot more to it than that, right?
Exactly. It's not just about appearances, it's about functionality.
Yeah.
And, those pressure changes impacting circulation.
So before we get into the different ways to manage varicose veins, let's talk about what actually causes them in the first place. Like what's going on with these veins?
Well, think of the valves in your veins as like these little one-way doors ensuring blood flows back to the heart. And when those valves weaken, for whatever reason, blood starts to kind of flow backwards and pool, stretching and twisting the veins.
Okay, so it's like a backflow problem, but
Right.
why does this happen? Like,
Yeah.
what makes those valves weaken?
It can be a lot of things. Age is a big factor, genetics play a role, and prolonged standing or even sitting can contribute. There are also different types of valve incompetence, like primary, where the valve itself is faulty.
Right, like it just doesn't work properly from the get-go.
Yeah, exactly.
Yeah.
And then there's secondary incompetence, which is often caused by previous blood clots or damage to the veins.
So it's like the pressure from the backed up blood actually messes with how the valve works.
Precisely. And this disruption in pressure is really key to understanding why varicose veins form.
Makes sense. Now, we typically see them in the legs, right? Like, why are the legs such a common spot?
Well, it's all about gravity. Leg veins have the tough job of fighting gravity to return blood to the heart. And when those valves fail, it's the legs that bear the brunt of the pressure.
So it's a tougher job for those veins, and they're more susceptible to problems. Okay, so we've got this backflow, the pressure builds up, and those veins start to become varicose. Now, what kind of symptoms do people experience?
The usual suspects are aching, heaviness, and swelling in the legs, often getting worse after standing for a long time. You might also feel itching, burning sensations, or even what we call restless legs.
Restless legs? That sounds fun.
Yeah, not really. And, in severe cases, ulcers or even blood clots can develop. So it's really not something to ignore.
Definitely not. So it sounds like managing these symptoms is really important, and that's where all these strategies our sources talk about come in.
Exactly. And luckily, there's a lot you can do, starting with some simple lifestyle changes.
Let's start with compression socks. They seem to be like the go-to recommendation. How do they actually help with varicose veins?
Well, compression socks apply a kind of graduated pressure, tightest at the ankle and decreasing as you go up. And this pressure helps the veins push blood back towards the heart, minimizing pooling and swelling.
So it's like giving your veins a little extra support, like a gentle hug for your legs.
That's a great way to put it. And there are different types of compression socks. They range from mild support to prescription strength compression.
So it's not just any tight sock, there's a science to it.
Absolutely.
Okay.
For most people, over-the-counter options with mild to moderate compression are fine for everyday wear.
But if you're having more serious symptoms, you should probably talk to a doctor to figure out the right level of compression.
Exactly. It's always best to get personalized advice.
Now, what about elevating your legs? That's another tip I hear a lot. How does that help relieve pressure?
Elevating your legs above your heart just helps gravity do its thing. By reducing the pressure on the veins in your legs, blood can flow back to the heart more easily, and you'll minimize swelling and discomfort.
So it's like giving your legs a break. And I'm guessing it doesn't have to be anything fancy.
Not at all. A few pillows on the couch, or even just lying down with your legs up against the wall for 15-20 minutes a few times a day can make a difference.
Easy enough, especially after standing or sitting for a long time.
Exactly. It's all about building those healthy habits into your routine.
And speaking of healthy habits, regular movement is also key, right?
Absolutely. Think of exercise as like a natural pump for your circulatory system. Activities like walking, swimming, and cycling, they all strengthen your calf muscles, which act as secondary pumps aiding blood flow back to the heart.
So even if you're not a marathon runner, just getting moving can make a difference.
Absolutely. Every little bit helps.
Now, I'm curious about the connection between diet and varicose veins. I know we're supposed to eat our fruits and veggies, but what makes that so beneficial for vein health?
Well, it's not just about generic healthy eating. Certain nutrients are really important. For example, soluble fiber, which you can find in oats, beans, and flax seeds, helps regulate bowel movements.
Okay, so it's about keeping things moving internally as well.
Exactly. Because all that straining and pressure from constipation can worsen vein problems.
Makes sense. And what about salt? I've heard that too much salt can be bad for varicose veins.
Absolutely. Excessive salt leads to water retention, which increases swelling and puts extra strain on your veins.
So cutting back on salt can make a difference.
It can definitely help. And it's not just about fiber and salt. There are other nutrients that are good for vein health, too.
Like what?
Well, antioxidants, particularly flavonoids, which you find in berries and citrus fruits, they help protect blood vessels from damage.
Okay, so those are good. Anything else?
Vitamins C and E also play a role in maintaining the strength and integrity of vein walls.
So it's a holistic approach, incorporating all these different nutrients to support those veins from the inside out. We've covered diet, but what about clothing? Can what we wear affect varicose veins?
It can. Tight clothing, particularly around the waist, legs, or pelvis, can constrict blood flow. It's like putting a kink in a hose.
So basically, avoid anything too constricting.
Exactly. Opt for loose-fitting, comfortable clothes, especially if you spend a lot of time sitting or standing.
Now, what about shoes? Is there any truth to the high heels are a bad thing?
Well, high heels can definitely exacerbate symptoms. They force your feet into an unnatural position, limiting ankle movement and hindering the calf muscle pump, which ultimately makes it harder for blood to return from the legs.
So maybe not the best choice if you're dealing with varicose veins. Sticking with more supportive, comfortable shoes is probably a better bet. What about massage? Can that be beneficial for varicose veins?
Gentle massage can be helpful for improving blood flow and relieving some of the discomfort. The key is to use gentle upward strokes towards the heart and avoid direct pressure on the varicose veins themselves.
So it's more about encouraging blood flow, not forcing it.
Exactly.
What about weight management? How does that tie into vein health?
Well, excess weight puts additional pressure on your veins, making it harder for them to function properly.
So maintaining a healthy weight can help alleviate symptoms and maybe even prevent varicose veins from developing in the first place.
Precisely.
Okay, so we've talked about a lot of lifestyle modifications, but what about those who need more than lifestyle changes? Our sources also mention medical treatments for varicose veins.
Right? And there are a lot of options available. When lifestyle adjustments aren't enough or the condition is more severe, medical treatments can offer relief.
I'm definitely interested in hearing more about those.
Well, we can dive into those after a quick break. So, we've talked about all these lifestyle changes, which can be really helpful, but there are definitely times when seeing a doctor is important. Like, if those changes aren't making a difference or if things are getting worse, you really want to get professional advice.
Yeah, that makes sense. What are some of those red flags people should be on the lookout for?
Well, persistent pain that doesn't go away, even with, those home remedies we talked about, that's a big one. It's like your body's way of saying, hey, something's not right here.
So don't ignore those pain signals. What else should we be paying attention to?
Significant swelling that doesn't go down, even when you elevate your legs. That's another sign that something might be more serious.
Okay, so pain and swelling, that's not improving. Anything else?
Yeah, any changes in the skin around the affected area, like if it becomes darker or leathery or you develop a rash, that's definitely something to get checked out.
So those are visual cues we can look for. And you mentioned ulcers earlier. What are those exactly and why are they concerning?
Ulcers are like open sores that can develop on the skin, often near those varicose veins, and they can be really painful. They're basically a sign that there's a problem with circulation and you need to see a doctor.
So early intervention is key.
Absolutely. Addressing these issues early on can make a huge difference in the long run.
Okay, so when in doubt, get it checked out. Now let's shift gears and talk about those medical treatments for varicose veins. We talked about how there are a bunch of options available, so let's break those down a bit.
Okay, great. So let's start with the minimally invasive procedures. These are often the first line of treatment when lifestyle changes aren't enough. One common procedure is called sclerotherapy.
Sclerotherapy, that sounds intense.
It's not as bad as it sounds.
Yeah.
Basically, they inject a solution directly into the varicose vein, and that solution irritates the lining, causing it to collapse and eventually fade away.
So it's like a targeted attack on those problematic veins. Are there other minimally invasive options?
Yeah, there are a couple of others that are pretty common. Endovenous laser therapy, or EVLT, and radiofrequency ablation, which is also known as RFA.
We touched on those earlier. Can you remind us how those work?
Sure. Both EVLT and RFA use heat to close off the varicose veins, which then redirects blood flow to healthier veins.
So it's about rerouting the traffic, so to speak.
Exactly. EVLT uses laser energy, which can be more precise, while RFA uses radiofrequency energy, and that might be better suited for larger veins. But they both have pretty quick recovery times and aren't too uncomfortable.
So it's about choosing the right tool for the job based on the specific veins. What if those minimally invasive treatments aren't effective or the condition is more serious? What happens then?
In those cases, surgery might be necessary. And the two main types of surgery are vein stripping and vein ligation.
I've heard of those. How do those differ from the minimally invasive procedures?
Well, vein stripping involves actually removing the problematic vein through small incisions.
So they take it out completely.
Yep. And vein ligation involves tying off the vein to stop blood flow.
Okay, so both are aimed at redirecting blood to those healthier veins.
Exactly. And while they are more invasive, they can provide long-term relief for people who really need it.
It's good to know there are options for even the most challenging cases. Now, I imagine it can feel overwhelming trying to decide which treatment is the right one.
It definitely can be. And that's why talking to your doctor is so important. Discuss your concerns, understand the risks and benefits of each treatment, and work together to figure out the best plan for you.
It's a partnership, and that open communication is key. Are there any questions people should be asking their doctor during these consultations?
Absolutely. Ask about the specifics of each treatment, like what it involves, how long it takes to recover, what are the potential risks and benefits, and what are the long-term prospects.
So really getting a clear picture of what to expect.
Exactly. And don't forget to mention any other health conditions you have or medications you're taking.
Right, your doctor needs all the information to give you the best possible care. And what about costs and insurance coverage? Those are important practical considerations.
Don't be afraid to ask about the financial aspect, too. Find out how much each procedure costs and whether your insurance will cover it. Many clinics also offer payment plans or financing options.
So explore all those possibilities. It really highlights the importance of finding a doctor you trust and feel comfortable talking to someone who will take the time to answer your questions and help you make informed decisions.
Couldn't agree more.
Now, for those who aren't ready for medical treatments or maybe want to focus on prevention, what advice would you give?
Well, we can't completely eliminate the risk of developing varicose veins, especially if you have a family history, but we can definitely minimize it. Maintaining a healthy weight, staying active, avoiding prolonged standing or sitting, and making those healthy lifestyle choices we talked about earlier, all those things can make a big difference.
So it's about being proactive and taking control of the things we can control. But what if, despite all our best efforts, those varicose veins still develop?
It happens. But the key is early detection. If you notice any of those warning signs we talked about, don't wait to see a doctor.
And remember, there's no shame in seeking help. It's about taking care of your health.
Exactly.
Now, as we wrap up this segment on medical treatments, I'm curious about the future of varicose vein management. Are there any exciting advancements on the horizon?
Oh, absolutely. This field is constantly evolving. Researchers are working on new medications, minimally invasive techniques, and even stem cell therapies to offer even more effective and personalized treatments.
That's amazing. It sounds like the future is bright for people with varicose veins.
It really is.
So while those advancements are in the works, what can we do today to manage varicose veins effectively?
Well, we've covered a lot of great strategies in this deep dive.
We've explored the causes, the symptoms, the lifestyle modifications, the medical treatments, and now even a glimpse into the future of varicose vein management.
It's all about empowering you to take charge of your vein health.
And that's what we're all about here on The Deep Dive. We'll be back soon with more deep dives into topics that matter to you. Until then, stay curious, keep exploring, and take good care of those veins.
And remember, healthy legs lead to happy travels.
So we've spent this whole deep dive really getting into the nitty-gritty of varicose veins. We've covered what causes them and all those, different types of valve problems, and of course, all the ways you can find relief.
Yeah, we've talked about everything from compression socks and diet to all those medical treatments like the minimally invasive ones, and even surgery when it's needed.
Right, and I think it's really empowering to know that there are so many options out there. But I think one thing that really stood out to me was the importance of those lifestyle changes.
Absolutely. Simple things like moving more and eating a healthy diet. Those can make a real difference in managing symptoms and preventing things from getting worse.
And it's never too late to start making those changes. Even if you've already got varicose veins, those healthy habits can still help.
Exactly. It's all about taking control of your health and well-being.
Now, before we wrap up this deep dive, I want to leave you with one final thought. We've given you a ton of information about varicose veins, but knowledge is only powerful if you use it, right?
I completely agree. It's like having a toolbox full of tools, but never actually using them to fix anything.
Exactly. So as we say goodbye, I want to challenge you to take action. What's one small step you can take this week to improve your vein health?
It could be anything. Maybe it's scheduling that doctor's appointment you've been putting off, or buying a pair of compression socks, or even just adding more fiber to your diet.
Or maybe it's finally getting up and moving more. Whatever it is, just take that first step. Remember, even small changes can make a big difference over time.
That's right. Consistency is key.
So we hope this deep dive has given you the knowledge and the motivation you need to take charge of your vein health.
And remember, healthy veins mean happy legs.
We'll be back soon with more deep dives into topics that matter to you. Until then, stay curious, keep exploring, and take care.